Pain, that medically elusive evil. What about changing the focus from controlling pain to understanding pain as more than a symptom? Can pain be cheated? My name is Dr. Dean, chiropractor and physiotherapist. My goal is to reframe how medicine understands pain to improve care. This podcast series is dedicated to a same-day conservative treatment for low back pain. This podcast has a companion published article number 42. Welcome to the Pain is Not the Only Problem podcast. Article 42. Pain is not the only problem. Course of care. These articles intend to reevaluate the prevailing clinical practices thought to manage low back pain, submit and debate novel low back pain contributors and mechanisms, meet patient expectations and satisfaction and clinically meaningful results, recommend a conservative, non-surgical course of care to override pain instantly, and restore ADLs and patient confidence on the first visit at low cost. The first encounter establishes the expectations and values of the low back pain patient. The clinician must be keen to respect and protect them through the entire course of care. Building the best possible relationship between the patient and the doctor requires reframing the accountabilities of the patient and the virtues of the clinician. Historically, patients have been taught to rely on the doctor to remedy their health problems, that doctors are gods, and that doctors do no harm. Historically, doctors have been trained to represent superiority, paragons of medicine, and the apotheosis of health sciences. Historically, the patient has been the victim of the doctor's reign, powerless to question or make choices in care options, rather settling for routine treatments that are sold to them without explanation of risk, harm, or cost. In other words, medical ego has commanded superiority over patient values. Because this dynamic perpetuates, real dynamics can't exist unless an alternative platform is available. With an alternative platform, the first encounter can empower the patient to control their course of care and steer the clinician's duty towards personalized care. The course of care should define the needs and the requirements of the patient. An educated and empowered patient that does not bow down to medical omnipotence. The patient is in complete control of their care as defined by the personal expectations and values that is afforded them involving insurance. The patient is in complete control of their care as defined by their personal expectations and values that is affordable without involving insurance. This alternative platform is a systems design model in which the inputs, throughputs, and outputs are defined by the patient, also known as the user, affording patients and clinicians an option to the broken for greed insurance manipulated model. The idealized healthcare system is renamed the business of sickness. The proposed systems design is constructed to match patients and doctors that intend to focus on accountability, affordability, and creativity to resolve the most common clinical complaints, such as low back pain. Course of care definition. The course of care is a proposal for the entire duration of the treatment plan that includes resolution of the problem list using an agreed strategy involving primarily patient contributions, along with the clinician's ongoing conservative coordinated care advice, with a personal and professional warranty that the best outcomes will be made possible with the most economy of the patient's time and finances and at least risk to the patient. The course of care begins with the clinical reasoning to establish the care plan and ends with clinical reasoning that explains the expected outcomes. This is the essence of a systems-based model. A non-systems-based model begins with a medical anything and ends with a medical anything, and in both cases no explanation or accountability is offered. This is the essence of medical guessing. In this example, we intend to explain that medical anything means that there is no diagnosis, and ending with medical anything, the causes of function, but rather on pain. Medical guessing involves medical magic. The medical clinician offers a medical procedure that seems complicated and impressive, yet no promises of accountability nor promises of results are made nor implied. Instead, the clinician confounds the patient with a sales pitch that price tag and complexity equals results, when in fact conservative care could have provided better results on the same day at very low cost and without any risks. Appropriately, the course of care begins with clinical reasoning and a complete diagnosis that the patient understands and agrees with, and important differential diagnoses are discussed. The clinician initiates a commitment to patient advocacy while promising swift results at low cost. The clinician offers an entire experience for the entire patient. The clinician discusses all important contributors to the patient's low back pain, including sympathetic amplification, diet, and personal bias. The clinician explains the goal to establish spinal stability by explaining its definition and the pathway to achieving it. Certain low back pain cases require an emergency or 911 approach. The patient presents with unrelenting pain not due to known trauma or underlying cause. These cases require immediate care to abate pain and restore function. Conservative care can provide impressive instant results. Once established, a return to functionality and performance dominates their course of care. The most important prescription is brisk walking 10 to 20 minutes, even with pain, to reestablish sacral motion on the same day and every day upon waking, without interruptions. On the same day, a multiplanar active range of motion drill series reestablishes spinal segment coupled motion. After 3 days, the patient explores hip mobility and explosiveness. Finally, the patient explores axially loaded core reactive drills in multiple planes on command. This program is at least 100% effective with excellent patient compliance. When the clinician focuses on pain only, there is no hope for patient satisfaction, and medical trust decays. A complete course of care is able to provide swift results and reestablish daily activities, and even improve the baseline of spinal stability and patient awareness and accountability. Pain was never the only problem. Thank you for joining me today. Let's advocate for improved patient satisfaction and for the profession. Let's demonstrate a cross-cultural willingness to strengthen medicine. Thank you.